the floor is yours. And thank you so much for joining us.
Thank you. So I'm just going to start off by reintroducing myself for everyone. I'm Isadora Rodriguez Legendre. I am the Executive Director at the New Hampshire Council on Developmental Disabilities. And so we call it the DD Council for short. So you'll hear me say the DD Council instead of that long name, but if you're looking for us online, you want to look for the New Hampshire Council on Developmental Disabilities. So I have a very short PowerPoint. It's just, a few minutes of a presentation so you can get to know a little bit more about the DD Council. And then I wanted to share some information about some public health workforce funds that came to us through ACL. That we have put out an RFP or a request for proposals on, and that is available on our website and will also be shared. I want to also say that the presentation itself and the supporting materials will also be shared with the entire group, so don't feel like you have to write everything down. And again, the public health workforce RFP is on our website. So I will put that in the chat for you once I finish. Okay, so with that, I'm going to start my quick slideshow. So the DD's Council's mission is that we are dedicated to dignity, full rights of citizenship, cultural diversity, and equal opportunity for all New Hampshire citizens with developmental disabilities. So we are an organization that really is focused primarily on our citizens with intellectual and developmental disabilities. And I'll talk a little bit more about that. DD councils were created by a federal law known as the DD Act. And the DD Act created a number of different organizations. We call them the DD Act federal partners. And in New Hampshire, they include the Disability Rights Center, New Hampshire, which is the legal branch of the DD Act. It's focused on people's rights. The IOD, which is a University Center on Excellence in Disability. So that is UNH's Institute on Disability, or the IOD, is concerned more with the research aspect and putting out information about people with developmental disabilities in our state. And then we are the advocacy branch of what we do in regards to the DD Act. Is we really advocate for systemic change, capacity building in New Hampshire to be able to support individuals with intellectual disabilities and developmental disabilities to be able to live and work and play in their communities. So we do a lot of policy work, but we also do some grant funding. So I'll talk a little bit more about that. So there's a DD council in every state and territory, and we are 100% federally funded in New Hampshire. So we get no state dollars, which kind of puts us in this strange place. We are a state agency, but we get no state funding. So we have to follow two sets of rules, with the federal rules and the state rules. So we have two budgets. We have a state budget and a federal budget. So there are some benefits to that, and some of those include that we are not subjected to things like hiring freezes or travel bans when the state has them, because our funds don't come from general funds. So we would be able to put in waivers and things like that. During COVID, it did happen that there was a hiring freeze, and we were able to get approvals to go ahead and hire because of our funding source. So we support public policies and initiatives that remove barriers for people with disabilities and promote opportunities for them to engage in their communities. A lot of what we do is we collaborate with other people. We can't do this work alone. Because we're what's called a minimum allotment state, we get about $500,000 to do what we do in New Hampshire. We only have 2 full-time staff right now and a handful of part-timers. So that really requires us to work with other people. We do a lot of small grants for community projects, and we do some larger, what's called demonstration grants. So I will talk more about those in a minute. I want to talk for a second about our membership. So per the DD Act, the federal law states that at least 60% of our membership must be individuals with lived experience of intellectual and developmental disabilities and or parents or guardians of either children with developmental disabilities or adults who cannot advocate for themselves. We're also required to have at least one representative that either is formally had resided in an institution or is currently living in an institution. So that membership requirement really solidifies the work we do as being led by the people most impacted by the work that we do. So our council members, they meet regularly, they have committees, standing committees, and they have task forces, they have work groups that work on different projects and activities. And they are really a working council, right? Everyone on our council is participating in something that they really believe in and that impacts their lived experience. So about a third of our council is family members, about a third is individuals, and then there are what we call the mandated agency seats, and those are named in the DD Act to represent different projects or programs or laws in place that support people with developmental disabilities. So these include our DD Act federal partners, the DRC and the IOD. The Bureau of Developmental Services is on our council, a representative of special education, vocational rehabilitation, the Bureau of Elderly and Adult Services. PPN is the private provider network. They represent service providers that are not through the area agency system. And then we also have a representative of Title V, and that currently that seat's being held by someone from the New Hampshire Family Voices. So we really have a very robust membership. They're gubernatorial appointments. They serve 3-year terms, and they can serve up to 2 3-year terms. And although they are volunteers, we actually just approved in our budget that non-agency seat members will be able to get a stipend for their participation because we really value their time and their input. Starting at the beginning of the next calendar year, we will be providing about $15 an hour. So our meetings are long too. So we have 3-hour meetings. It's $45 for 3-hour meetings and $75 for our longer full day meetings when we do our retreats and our annual meetings. So this is an infographic. I love infographics of our current 5-year plan. We're very proud of our 5-year plan. We really took a lot of effort in simplifying what we were going to work on, but still have the flexibility within the objectives to, as COVID taught us, to be able to shift priorities, to be able to address different emerging needs and issues in our states that impact people with intellectual and developmental disabilities as they arise. So the first one is quality of life. And as you can imagine, this could be pretty much anything and everything that impacts the quality of life for someone with a disability. A lot of what we do, again, is bolster community programs, work on different work groups or participate on different work groups that address quality services in New Hampshire for people with disabilities. And then we also do some policy, and this is more systemic policy. So agency policies, we work on with people on technical assistance to help improve their agency or program to better include people with disabilities in their work. And then our second overarching goal is advocacy and training. And again, this is a very broad overarching goal, but it really is meant to strengthen civic engagement and advocacy in New Hampshire. We do a lot around self-advocacy. We support a lot of different groups of advocates who are leading the charge to creating better opportunities for people with disabilities in New Hampshire. We monitor policy every legislative session. We're looking for bills that may impact the disability community, and our members typically will testify, provide education for legislators around how a particular policy or bill would impact their lived experience. And so it's very powerful because we use the power of personal stories for our advocacy work. And then two of our newer initiatives are around information access, and that includes, you know, things like we developed a small grant for agencies and trainings or conferences to be able to apply for assistance with CART services or ASL interpreters, so that materials and different opportunities can be available for people with different types of disabilities. And then equitable education, which is really our targeted disparity. Our data that we cited says that there are inequitable outcomes for students of color with developmental disabilities. And we are working on developing some sort of project or RFP to help address those needs, those inequities. So that brings me to our public health workforce funds. So the ARPA did set aside funds to provide recruitment, training, hire, and continued development of public health emergency issues for public health workforce or respondents to public health emergencies. So what that means to us is we received from ACL, which is our funder, the Administration on Community Living, $83,000. And it's really intended to help recruit, train, hire public health workforce that is either continuing to address the COVID-19 pandemic and some of its resounding issues, and also to prepare for future public health emergencies. So the RFP that we put it out a couple of months ago, and we didn't get any hits, so we kind of opened it up to a longer period of application. I was supposed to present last month, so my apologies that now we're kind of up against the deadline again, but the funds do expire in about a year, and so we want to go ahead and get this work contracted. Now, we are encouraging people to be creative. We did send out some letters to our community of people that we typically partner with. We're recommending that people be creative in identifying gaps in support, in information access, in coordination for public health emergencies, and really think about also ways that these funds could be used to create connections in health and wellness for people, to combat continued social isolation for people. And there is a very specific FAQs that the federal government has released on this, and it's a document that was sent to us, so we will share it with all of you so that you know kind of what the intent and purpose is and the different types of positions that this can include. But we've told people that, you know, it's all about how you write it, and if you can fit the a creative project to address the continued issues that COVID has created, and then use some of the words that the federal government has given us to address public health emergencies, or to continue to address and prepare for future public health emergencies by helping people get connected, stay connected, accessing PPE, doing some sort of information campaign or video campaign about staying healthy and staying connected. It can really be very flexible when you think of it in those terms. But again, it's all how you write about it. These I just wanted to share. So I will go back to the public health workforce funds, but I just wanted to share some of the other projects and activities that we support typically as the DD Council, and they include different publications that address disability issues. They include different conferences. We are usually at information tables at these conferences and at Pride events and different opportunities. And then I also like to share with people that we have these grants available, small grants for individuals who are personally connected to intellectual and developmental disability to engage in education or leadership opportunities, and then other small grants to really help address community inclusion. So there's more information about that on our website. And then what I was going to do is, we'll stop sharing here. And if folks have questions, I just want to quickly pull up the one pager from ACL about the funding itself. And it's kind of lists a whole bunch of different potential jobs or responsibilities that these funds can be used to bolster, and they're meant to supplement, not supplant, obviously. But they can go to recruiting, hiring, they can pay for benefits, that's in the FAQs as well. But it's really meant to increase the number of public health workforce respondents around public health emergencies for people with developmental disabilities. And again, it's a lot of information, and I didn't want to kind of get into the weeds about the funding in particular. The RFP is very detailed. Also, I will link that in the chat for you all so that you can have a look and share it. I know that the deadline is coming up soon, but again, if folks have questions or inquiries or just want to share the information with someone, you can apply for parts of it, small, if you only need 5,000 for, supporting an agency's needs to address a particular vaccination strategy that isn't being addressed with other funds, like you can do that. We have we have the new boosters coming out, and that is always on my mind, that people could certainly use additional funds to get those out into the community. Now, we are especially targeting people with developmental disabilities and older adults with these funds. That's typically a question that I have too. Does anyone have any questions about the DD Council or about the public health workforce funds? So I have something in the chat. Thank you, Joan. Can funds be used to apply for technology to enable access to be provided? So ADA kits, iPads for ASL interpretation. So it's intended for workforce. So my response to that is that unless somehow the purchase of that technology is increasing the workforce, then no, that would not be an allowable expense. It's really meant to address personnel shortages.
Isadora, is the money meant, I can't. Is the money meant to actually pay for, like, to recruit, hire, train, and support community health workers? I mean, it doesn't seem like a whole lot of money.
It's not. So, and they've kind of offered some different examples of a lot of the DD councils that have gotten these funds have run into this issue. So we ourselves, as a state agency, could not use the funds to hire someone to work on COVID, because then that position is not sustainable through our budget, right? And so that has created a barrier for us to be able to ourselves and a lot of other agencies use the funds to hire a person. What we were told is that the funds can be used, for example, to support additional hours for someone, or to cross-train someone to address public health emergency issues that impact the disability and older adult communities. So that then for example, if there was the state emergency preparedness team wanted to train an individual specifically on things like addressing the needs of people with disabilities and older adults, how to develop plain language materials to be able to disseminate information quickly in an understandable way during public health workforce emergencies. So the functions that are specifically serving the community and intended to address future health emergencies, that training or those efforts can be paid for with these dollars, so that it's working in tandem with an existing position, but it's increasing the knowledge, it's increasing the availability of workforce that is specialized or skilled in addressing those needs. We were also told that for a lot of agencies that hire part-time support people, right? We work with a lot of different agencies in New Hampshire where direct support professionals and direct support staff are not full-time benefited positions. But for example, these funds could be used then to increase someone's hours, to help individuals engage with the community in a way they're not able to because of the limited resources that they have to support community engagement, how that person would need, or in a person-centered way, because of the way COVID has impacted the community access. So someone may need additional supports or one-on-one supports or some specialized medical equipment to be able to engage. Again, it's been difficult to find that kind of sweet spot of like, okay, we can't pay for a full-time position with benefits because the funding is going to end in a year. And not a lot of us work with direct services or bolstering the direct support professional workforce that works with individuals. How do we find projects and activities, things like trainings, things like community community integration initiatives? So an idea would be, and I just recently had a question about supporting staff that can help people with disabilities participate in a community, music program, or a community-based support group to help address social isolation. So because a lot of our folks need transportation help, they might need staff to support their activities of daily living while they're in the community. It's even harder for people with disabilities and older adults to even get to the community center to participate in different activities because they lack the support they need to get there. So these funds could help different agencies or different organizations kind of come up with a way to get people more engaged with the community with increased staff support. So, and I think the staff support has been the thing that really is causing some issue, because it has to in some way, shape, or form increase workforce. Yes, and
Isadora, is it, if somebody has maybe like a beginnings of a thought in their head, are you open to having a conversation with them about whether it makes sense or how to maybe reform it to meet the requirements? Yes. Okay.
Yes.
Great.
Because it's all about how you write it, and even I've gotten at least one person share an idea with me, and the idea could work, but not the way they wrote it, right? So it would have to fit into what the federal intention is, and it does. It's just not described in the way that it needs to be described. So I'm happy to help people kind of see if they have an idea for potential use of these funds that could fit into that umbrella of what the government intent is for these funds.
That's great. That's great. Great. So you're gonna
put a bunch of stuff in the chat for everyone.
Put a bunch of stuff in the chat. Okay. Any other questions for Isadora? Okay, well, I know that they have been trying to get these funds out into the community for a long time. So I hope maybe this sparked some thought for someone or